Please could you stand?
The WHO representative and representatives from UNICEF, SPC, and government agencies, executives of the Fiji Institute of Environmental Health, and the environmental health officers from the local municipal councils. I'm so happy to see you today, and also our environmental health officers from around the country, ladies and gentlemen. First and foremost, I just want to say thank you. Thank you very much for all the hard work you've been doing throughout the year. And on behalf of myself and the Honorable Prime Minister and your Minister in the local council, I say thank you to all the work that you've been doing. One thing that I said in Parliament, when I was asked a question about dengue, I said there's a lot of work happening outside of the hospital that people don't see. And that is the work being done by our health protection officers. And, that's the roles that you play. And many times they are not seen, but I know that it's being done. And I know that your families realize that you actually work very, very hard. You might not be at the pinnacle of what is being shown, but you actually work very, very hard. Is it too loud? We can push it back. Okay. And you work very, very hard. So first and foremost, I just want to thank you today. So, Christmas is coming. If nobody thanks you, you can say the Minister of Health came to thank me. Joe and Ben usually work together to put my speech together. And usually I read it, and when I actually make my speech, I go off track, just to keep them interested, because they already know the speech. But one thing that is very important to me is that we all come together and work together, because alone, as a Ministry of Health, we can't. And as a Minister of Health, I believe in many years we've always thought we can. And I want to say today, on our own, we can't. And that's why we need the support of everyone. Local councils are very, very important. The other agencies within government, the other agencies like development partners, and more importantly, the non-governmental organizations that support us. So what I want us to do is to actually realize that instead of us being in the middle, we're actually part of the ring. And the person in the middle is actually the people we serve. And that's one thing that we as doctors have had to learn. Yeah. And I'm a surgeon, and when I started training to be a surgeon, the way the hospital is run, the surgeon is right at the top, and there's a big ward round, he's always in the front. When I went to New Zealand, in some hospitals still the same. And we finally realized by doing that, we didn't achieve anything. Because what happened was we were not in the outskirts, in the ring, with the patient in the middle. We wanted to be in the middle. And that's one thing we as doctors have learned, and we've tried as much as possible as a group of doctors in this country to be able to ensure that we work hand in hand with the team that is before us. And that's one thing that I want to begin with by saying that all of us being here today shows that we are all part of that outer ring. And the people of Fiji is in the middle of that ring. And that should be the essence of what we do. It's a multi-sectorial approach for universal health coverage and to leave no one behind. I was in Mbua last week. And I came back from Mbua and I went to the Lao Provincial Council meeting. Now I'm from Lao originally. I've been to the village many times, so don't ask me that question. But anyway, one thing that I noticed when I went was that my people from Lao felt that I hadn't been visiting Lao, that maybe I was giving them a miss. And I said to them, I want to make it very clear that as part of the Ministry of Health, but more importantly, part of the government's approach, is that we will leave no one behind. Whether we're in Lao, we're in Mbua, we're in the upper reaches of the Wendimala or the Singatoka, no one will be left behind. And the roles that you play are very important, because the doctors can only go so far. The nurses can only go so far. You penetrate through every platforms that are there. You penetrate right through. And that is the importance of the roles that you play. You address all the physical, biological factors of a person, and your discipline acts both as an advisory, but also as the group that provides definitive action. And one good example of this is the fact that at the moment we are at the threshold of this big measles epidemic. We are hit on every side. We've had that measles that come through. We've had maybe a spot of measles here and there. We've got the Fiji futsal team still waiting in New Caledonia, but we are reliant on you. You are the people that are going to activate that response, that health protection. One thing that I relate to the DOT team in Central Division on when I saw them on Monday was that back in the days, the Mbati or the warriors, their role was to protect the village, the Abusa, the tribe, and the Bandua. In this new age, you are the Mbati, you are the warriors. Your role is to protect. And it doesn't matter if you're a woman, it doesn't matter if you have 10 children, you are the Mbati. You don't have to have six-pack, you don't have to have many muscles. You just got to have the strategy, the thinking, the passion, and the desire to protect this nation. And the measles epidemic, if you do your work right, we will be able to control, contain, and limit the effect if it does happen in our nation. Your important role includes making sure that we achieve our SDG targets around WASH. One of the things that I've been very passionate about is working hand in hand with many of you about achieving this target. Recently, Salote was spending quite a few nights up in the villages in Wenimuka and also Nalinti in Nakorotubu, working with them around the water seal toilets. And I was actually quite pleased to actually go with her and actually witness what he has done. When we talk about empowerment, words alone cannot achieve that. We've got to action it. We've got to action empowerment. Words alone cannot achieve empowerment. And simple things such as a water seal toilet is the greatest empowerment that we can bring to the table. In adopting the development agenda of transforming our world, our government, along with 192 countries, vowed to transform the world. Unlike the MDGs, the SDGs are very action-oriented and it's time frame oriented. We're going to achieve it at a particular time. And that's what we've decided to do. And what we need to do is we need to run around like a dog with a tail that's on fire. And that's the passion that we need to drive ourselves with. We have pledged our commitment to achieving SDG 6, and that includes within the next 5 to 20 year development plans, working hand in hand with other stakeholders to achieve that. Now, if you think about my idea of eliminating LTD, TB within the next 3 to 5 years, if you also just think about getting WASH all over Fiji, adequate sanitation, adequate water to every household, we can actually achieve that if we achieve, both of them are interlinked, in my opinion. They are interlinked. The eradication of LTD and TB plus WASH for every household, every school, effective WASH in every institution, I think are interlinked. Because it also shows a level of empowerment in a sense, a level of development, and also the approach towards quality health. It also means that we have to work hand in hand, as I've alluded earlier, with other development partners and also with other ministries that are involved in infrastructure and so forth. Your field is very, very vast, very, very vast. And I think all too often, many people do not understand the vastness of your field. I have challenged the Chief Health Inspector within the ministry to start looking at ways in which we can continue to improve and work on the sub-interest areas within the field of environmental health. For example, food security and so forth, vector. And I think we are, as a nation, in now being a developing nation, and the fact that we have come so far, we need to now aspire towards having specialties in those particular areas, but actually having the cohort of people that will continue to run it. It can't just be based on one person. One person goes and trains on food and comes back and does that work and decides to leave, and then we fall apart. We can't do that. So we've got to develop the sub-discipline areas, we've got to maintain it, and we've got to work with it. And what you need to do is you need to talk with the education institutions, FNU is here, about how we're going to achieve that. I also am pleased to see that recently we had the graduates from the Advanced Public Prosecution course. And again, as I said, empowerment is about actually actioning it, actually doing it. So, I wish them all the best, but they actually need to take it to the table and do the work that they've been learning to do, and do it in a better way. As we continue around the world to grow, the challenges that are upon us, they continue to grow also. And I like what has been discussed this morning, the idea of climate change, because we can't run away from the fact that climate change is affecting a lot of the environmental diseases that we actually see. And it's imperative that we understand it fully, and that we devise strategies to combat it. And the role of research is so very important also in this. And I want to continue to challenge us that research should not be limited to the academics. We should do our own research. We should understand our own subdivisions, understand what works, what doesn't work. As a government, we are keen to ensure that we continue to raise the level and the number and the quality of health professionals. Very soon, in the next few months, I've asked the Permanent Secretary to sit down with the education stakeholders and have a look at the areas that we want training in. I hope by then you would have had some discussions with the public health team in FNU and also University of Fiji, and being able to advise us on what are the courses that be important as we go forward. I sincerely hope that this today's symposium will suit your agenda and your roles as environmental health officers, and the key drivers of eliminating environmental health issues and the impact on human health. This morning, I was sitting in the cafeteria, just on the phone, messaging the doctors, the group of doctors, the Fiji Medical Association. I was just saying to them, I want you to have a think about the next level of commitment, about the next level of passion. Because, again, this word passion, we look at it and we say, I'm going to be passionate. And many times we quantify it and say, I'm going to do this, I'm going to wake up at 6, I'm going to do that, I'm going to do that, I'm going to do that. And many times when we actually achieve that quantification of our passion, we then lose passion. And sometimes in professional organizations such as ours, such as nursing, such as doctors, that happens. We as a group, we come together and say we're going to be very passionate, and we quantify the meaning of the word passion. What I want you to do is quantify and qualify what the word, that meaning is, and the work that you do. Because one important aspect that I'm asking the doctors to do is to bring back compassion into their work. Because unless we have compassion, it will be very, very difficult to do the work that we do. That's the EH Ra talked to us from Bible verse from 1 Corinthians 14. 1 Corinthians 13, the whole chapter is on love. And I thank you that today you've come together as a group, and you're bonding, and that unity is there. And I wish you all the success in the next 2 days. Naka.
Gracias.